This is Let's Talk MS, the podcast of youth living with MS.
Let's Talk MS!
Welcome to Let's Talk MS, a podcast series created by young minds for young minds and proudly brought to you by the European Multiple Sclerosis Platform. I'm Anna.
And I'm Elisabeth.
And we will be your host for today.
In this podcast series, we unpack the intricacies of living life as a young adult while navigating the challenges that come with MS. From dating to nutrition to dealing with the MS stigma, we're here to navigate it all through expert insight and personal stories.
Today, we will be talking about pregnancy and MS family planning. So for this conversation, let me introduce our guest. We will have Vicki Mathews. She has worked as a nurse in the UK, dedicating her career to MS. Welcome, Vicki.
Thank you very much, Anna. Thank you. I'm delighted to be here on this podcast.
Thank you. And we'll also have two Young People's Network members. We'll have Iris Magnúsdóttir from Iceland, who has recently become a mom. Welcome, Iris.
Great. Thank you. Really excited for this conversation. Thank you for allowing me to join.
And we'll also have Nik Miskovic from Slovenia, who is a father of two. Welcome, Nik, as well.
Hey, thanks for inviting me. Lovely to be here.
To kick off this conversation, I just wanted to share a quick reflection. Between the ages of 20 and 40, many people start considering whether or not they want to have children. This decision is life-changing, and for those living with MS, it can feel even more complex. From family planning to pregnancy and postpartum care, individuals with MS must navigate a unique set of challenges and decisions, including compatibility of treatments, potential effects on their health, and the ability to parent while managing a chronic condition. Having said that, I would like to turn to you, Vicki, and ask, how should someone with MS who wants to have a child approach family planning?
Thank you, Anna. First of all, can I say congratulations to Iris and Nik on your parenthood and those many hours of sleepless nights and endless days. It does get better, I promise you, it really does, but congratulations anyway. So thank you for that, Anna. I think probably for me, I would take a couple of steps back for young people with MS who are receiving that diagnosis. And I would go back to maybe starting with their sexual health and well-being, because as we know, there are certain things that have to happen before you can think about being pregnant or giving birth to your children. So my starting point always would be just a brief conversation, a free conversation about sexual health and well-being, because MS can impact on one's sexual health, and as can treatments, both disease-modifying treatments and symptomatic treatments. So that's where I would start. And then hopefully follow on with some talk around contraception and fertility. And that is important both for women with MS, but for men with MS too. So to think about how the diagnosis might impact on those issues, and also think about pregnancy. And if one does become pregnant and you are expecting a child, about childbirth. And then afterwards, family life. So for me, these are all anticipatory conversations that you have well in advance at or around the time that someone receives that diagnosis and they're thinking about their treatment options. So I would say to young people, don't be afraid to ask those questions and don't be afraid to have those discussions. And, I'm kind of going to be championing here for MS nurses. They're often the best people for you to start having those chats around those issues. Here in the UK, 1 in 6 pregnancies are unplanned. So my premise is always, let's plan for both the expected, but let's always plan for the unintended or the unexpected. Preparation is key here, and can really make a difference to the experience that young people have, both in terms of their fulfilling relationships with each other, but also in their roles as parents to be, and then further down the line when they have their families.
Thank you, Vicki, for this. I think that's a very good point that you're making here, talking about fertility, contraception, And it's true that in our society, it's still very taboo. And there are those questions that we don't dare asking. And it's even more difficult when you're a young person. Talking about sexuality, talking about contraception is not something that we can always see in open forums, but there is a lot of questions there from the young people. And we had a previous episode also on sexuality. And I think it's really nice to see that indeed it's a story. The starting point is really there. The encouragement to the young people to ask the questions to the healthcare professionals, and the role of the healthcare professionals to help people to find the right information, to guide them where possible to the right healthcare professionals is really important. And moving on maybe to the family planning, when you have MS and you've been especially newly diagnosed with MS, there are all those question marks that come. It's a life-changing diagnosis, and how would you help them, or what would be your recommendations on how they should approach this question of family planning from your perspective?
Yes, I mean, I think that there are lots of questions around family planning and contraception. And again, it's critical that you come ready with your list of questions when you have a consultation with your MS specialist, be that a doctor or a nurse, because the type of treatment that you're on will play a very significant role in terms of contraception and fertility, whether you're on a first-line treatment, whether you are first-line injectable, whether it's a first-line oral, whether you're on a treatment for highly active MS, or whether you're on an induction therapy. They all have a different impact on contraception and family planning. So there's a whole lot of questions to ask, and please don't be afraid to ask them. If necessary, write them down, because it's all very overwhelming. You know, you're young, you're looking forward to the rest of your life, and then you get this, quite frankly, devastating diagnosis that kind of throws your world off kilter. So do write your questions down and come armed with your list. And there will be questions around treatments, the different treatments, and the impact that treatment will have on family planning and further down the line, obviously pregnancy. Some people choose not to become pregnant. So it's a really important conversation to have. And your clinician will welcome you coming with your firm questions ready for him or her to answer. So there's all that issue around fertility, for example. If a man with MS is on a treatment, what impact might that have on his fertility? If a woman with MS is on treatment, what impact will that have on her contraceptive measures? So that's your first line of questions around your treatment options. And then there are all the practical things around family planning, around when should you consider coming off contraception if you decide you want to become pregnant. So it's always good to have a kind of preparation, if you like, for things that you might be looking forward to, or that you may wish to not happen to you in the life ahead.
Another question based on what you've also mentioned a little bit earlier. Planning and unplanning is completely different.
Yes.
And yes, when you want a child, you're in that mindset and you're preparing yourself. But for people who have an unplanned pregnancy, and that might panic at the beginning, like thinking of all these things that they didn't have time to think about, and what it's going to be, about the treatments, about how to face that in a way. Do you have any recommendations for those people who would have an unplanned pregnancy and not to
absolutely
to panic when they have this good news?
Even before, if you think there is a chance that you may have conceived and that you may be pregnant, or that you may have had a relationship with someone where you may have got that person pregnant, you really must be unafraid and go straight to your consultant, your clinician immediately, and tell them and speak to them. And there's no judgment here. There's no sense of anyone saying, well, what on earth did you do? Why did you let that happen? Like I say, 1 in 6 pregnancies are unplanned. Wonderful, but often unplanned. So my advice is don't panic. Go and see your specialist immediately and talk it through with them. There are solutions. There are ways forward. Always, always. be safe and know that someone will be supporting you and give you the right advice and help you find the direction that you need to go in.
This message is perfect to jump into our next question, because Iris, I wanted to ask you, how did you feel about family planning when you were thinking about having a child and while living with MS?
For me, we had already started, me and my boyfriend, to discuss family and when we would like to have a child before my MS diagnosis. And I was finishing my studies at the time, and we felt like that might be the next step for us. But then my diagnosis came and just turned everything upside down, really. And I remember, I think it was just the first question I asked my neurologist in the hospital was, can I be pregnant? Can I carry a child? Can I be a mom? Is this still something I can do? And I was assured, absolutely, this is in the cards for you. But that just kind of went on hold, because now I was just focused on my MS and getting that under control. But the desire was there early on. The focus shifted, my MS became my number one priority. But this desire to have a family was always there in the background. When can I go there? When can I get the green light from the doctors? Yeah.
Iris, do you know that I remember when we first met in person in Palanga? I think it was 2022. I perfectly remember that you were talking about this, and that at the time you were worried, you were talking with your doctor and trying to see the possibility of having a child. So when I find out that you were pregnant on Instagram, I was really, really happy for you, and I feel so happy that you could finally do it.
Yeah, thank you. Thank you.
Can I add a little story in here just to demonstrate the shift in thinking now, where we really actively encourage young people, if they want a family, to go for it and have their family. I met a patient some years ago, quite a few years ago now, a wonderful woman in her late 70s, had lived with MS since she was diagnosed in the 50s, in the 1950s, so a long time, long before you guys were born. She was in her late 70s. She was fit. She was active. She was still walking, enjoying life. And she had been told in her 20s she had MS, so she was never to have children. Now, for her, that was the greatest bereavement, grief, and loss of her life, that she never had her babies. And I can't tell you how wonderful it is now that we have completely the opposite view amongst clinicians and MS specialists, because we know that, MS doesn't itself affect fertility or your capacity or your right and your confidence that you should have in being able to have your babies and have your children.
It's really important to see the evolution and to see that things have been changing. The messaging are also more understandable for the people affected by the conditions, so that they don't go into that dark tunnel from the moment they are diagnosed. And I think we've came a long way since these years, but there is still a long way to go. So it's really nice to keep reminding people there are with those positive message and showing the good examples that we have now with the guests today. So it's really nice to have this discussion. But maybe also from Nik's perspective, can you tell us more about how was your experience?
So how we approached, or how I approach towards the having children or not. I mean, before the diagnosis, I've had now since 2014, so it's been 10 years. And before that, I always wanted to have a bigger family. I'm the only one in the family. I always wanted to have some siblings, right? And that was my kind of really soul wish, right, to come true. And when we were discussing with my partner, with my wife, really in regards to having a family or not, we were always yes, we will have it. We'll just have to arrange some things, but we will go down this road, because I know I would regret it. I would regret it a lot of not having it, right? I wasn't taking any medications at that time, so it was quite straightforward. It wasn't that effective. I mean, it doesn't have any effect on two of us. But later on, when we decided that we could have another baby, I started digging up a lot of the things, and I was surprised because it's not only the women that get affected by this, right? It's not only that we have to take care if the women have MS, but it's totally the opposite. Also, we are here, guys. So it's quite important that we have the knowledge of whether to stay on the X medication or go to some else medication. Does it have any effect on the baby? Could it have? And so on, right? So this is quite a wide range of things that you have to put in your consideration, I would say. And then for our second baby, I haven't started any treatment yet because I said I wanted to be really clean, and I'm taking that risk. And that's it. I just decided that way, and I said, okay, whatever it's gotta be is gotta be. But this is our wish, and we are just planning of having another baby and to have it in a safe environment for all of us, right? But I think that it's much more difficult if you're a woman. You're 9 months pregnant, then you give birth to a baby, and then that baby is here at all times, right? So your mind really has to shift of having additional, like, newborn here. This is just a little grown up here, right? If we approach it that way. So you have to take care of it in the first years, like 100% or even more. And then you have to really set aside maybe some of your things and see, okay, this is what I'm doing in regards of building up our, generation, our foundation and stuff like that, right? This is how we kind of approach. And we said, okay, do we have enough energy to have additional baby or not, right?
Thank you, Nik, for this. I have a follow-up question because you were talking about the risks and about the treatments on how you wanted to be clean during that time. But maybe a question for you and Vicki, also both of you, is that because we have these recommendations that are coming up, and you might have heard about this report Time Matters for people with MS, that they need to be treated as soon as possible after diagnosis, so that it helps with the progression of the disease or the not progression of the disease. So there is this message that we will be pushing for, that people need to be treated as soon as possible. And it seems that taking this decision of, look, like I don't want treatment and so on because there is a risk, or that I want to be clean. So is there any misconception there? Anything that, Vicki, maybe you can also help us there to see if there is any messages for the young people that can help with these contradictory messages that they might receive and be in a position of taking a difficult decision?
Yeah, that's a really important question, Elisabeth. And also, thank you, Nik. You've raised some really, really key points, which I'd like to sort of pick up on. In terms of treatments, you're quite right. The sooner, the better. And, time matters. And so we treat as soon as possible. So most of the first-line injectables are perfectly safe to continue up until the point of conception. And again, you will need to talk to your clinician about risk versus benefit of whether you continue with treatment during pregnancy, whether you stop as soon as you realize you want to plan for a family. So between you, it's having that conversation about when do we want to have our family. As Nik said, they'd had one baby and then they thought, we would like the next baby now. I want to be in optimum health, ready for that conception. So it is all about preparation, and the preparation will very much be also around what treatment you're on. And now there are some therapies, particularly the induction therapies, where you would need to stop treatment and wait until you plan to conceive. And again, it's quite a complex picture. There are so many treatment options now, and it is really important that you and whoever you are partnering with sit down and have a clear idea of when you might want to try and conceive. obviously, as we've said, it might come along very unplanned, but because what treatment you are actually on or going to start will determine the safety levels around conceiving and around pregnancy when you have actually conceived. It is quite a complex picture, and I would really, really recommend that you speak to your clinician as soon as you get the diagnosis, to be quite honest, because at diagnosis, that's when your treatment options will be determined. So, yes, in terms of treatments, it will very much depend which treatment you are on in terms of whether you conceive and you stop treatment before you decide to conceive, or whether you continue with treatment during the time that you were trying to get pregnant and when you are successful and you have your pregnancy. It very much depends on the treatment that you're going to be on. And that is determined by the type of MS that you might have.
Vicki, if I can just jump, what are the alternatives if a patient cannot, or a young person cannot continue with the treatment?
Are there alternatives? Well, I mean, the alternatives would, of course, if they run the risk of a relapse, if their MS becomes active, there's no what we call contraindication to them having methylprednisolone. So they can have steroids if they have a relapse. If they have to come off treatment and their MS is active, they can certainly have methylprednisolone treatment during pregnancy and after childbirth as well.
I thought I was really clear with my neurologist when, like after diagnosis, I thought I was really clear, like I want to have a baby, like this is what I really want, and as soon as possible. And our aims did not align because his priority was to get my MS under control. And of course, that was my aim as well. But the desire for family was so strong that it really took a toll on my mental health that he said, let's do one round more of the drug I'm on. And it's working really great. But like when I started, I thought, okay, we're going to do 2 rounds. So start the medication, 6 months later, another one, and then we can go. And I thought this was the plan. And then he said, okay, let's do one more. Let's do one more. And I just felt my dreams like getting crushed every time. So like Vicki, you said in the beginning, we need to have the conversation. We need to be able to express our needs and our wants, because it is a benefit risk analysis here. It's not only my physical health, it's also my mental health. So this all needs to align and we find some balance, what our next step should be.
You're absolutely right, Iris. It is a joint conversation. And I have to say, it is your life and your right to self-determination. And I've always said to my patients, you are the expert on you. You know you better than I could ever know you. You know what you want and you know what your body will tell you in terms of those wants and needs. And planning is helpful to plan carefully, but clearly your neurologist had in his mind what he thought was the best options for you, but they weren't necessarily aligned with what your desires and what you felt were the best options. And, you know, at the end of the day, as a clinician, one has to respect what that person's decision is going to be and work around that in the best possible way, reduce the risks as much as possible with all the other options like your general global health and well-being, whether you take your vitamin D, whether you are comfortable with having steroids if you do have a relapse whilst coming off with treatment.
If I may, just to add to the point that you're making here, Vicki, in terms of the empowering the patient to take that voice and to express their desire, as Iris was very strongly saying now, it's very important that they feel that they can do it. And that across Europe, we can see that we're still not there in many healthcare systems. And it's really important that we can come this across with, like, this is a good practice to voice what is it, what would make your quality of life better. And what defines your quality of life is not necessarily an objective indicators, but that the clinician can draw up. So it's very important that you have these, you can express this, and that if you don't feel that you're supported in that dialogue, to find out also someone that can help you with that discussion. It could be a nurse if you are talking with your neurologist. It could be a patient or organization representative, but someone that can help you to have this dialogue. And I'm just really keeping in mind that across different countries, different experience, but there is sometimes there is a wall that the patient themselves don't dare crossing or breaking because they feel that they don't have this decision power. And this is something very, very important and strong to highlight this to our audience, is really to know that you have this power, but if you don't know how to express that, to find solutions that can help in this dialogue.
Absolutely, Elisabeth. And it goes back a bit to Nik's point. In this whole area of sexual health, family planning, pregnancy, childbirth, etc., men can be neglected and they can be slightly sidelined on this. And men, I don't like to generalize, but men often find it quite difficult to talk about things like these very intimate issues and private issues. And it's difficult enough as it is, but to be in a situation where the power balance is maybe not so good, if you're with a consultant or a neurologist, you might feel a little bit inhibited or a bit intimidated. Now, in the United Kingdom, we have what we call advocacy, and it's as an MS specialist nurse, we are ideally placed to advocate on your behalf so that it is your choice, your decisions, your right to self-determination that must be respected and supported. And we have to find ways and solutions to support your decisions about what you want to do. So I guess that's one of my take-home messages. Don't be afraid to say what you want and what matters in your life. Yes, we hold a lot of clinical knowledge and skills in terms of treatments, both disease-modifying and symptom treatments. But you know what makes you happy. You know what makes your life fulfilled. You know what you want. And we must respect and support you in that and find the best ways we can to help you achieve all those dreams and hopes. Because you're young, you have your lives ahead of you. And, you're at that point in life where you're making huge decisions amidst huge upheaval. You've been told that you've got this diagnosis and it throws your world off kilter. We're there to support you, not to take over. Remember that.
I can totally agree with you guys. Elisabeth and Vicki, you said it so well. It's just that one of the key messages, I would say, maybe from this conversation or from some others, is to really try to empower all the patients. Because like you said, Vicki, so well, it's the patient know itself the best, right? So it's crucial. It has so much of a burden, or so much weight of how the patient really feels and how it can express freely at any of the appointments that they have with their doctors, neurologists, whatsoever, right? Try to express yourself, because some of the things you have to decide, some of the chances or some of the paths you have to decide right now will affect your life in decades, right? So really just be, true to yourself. Just put it on the line, put it on the weight and say, okay, does it weigh more if I go totally, nuts and I don't even know myself? Or is it having a family and what can you bring to the family? So having an effect that you have to be okay and so that your family will be okay. Do you have that energy or not, and so on? Is it just a wish that you had been planted by your parents that you gotta have a family by any chance, right? Or is it your desire to really, push another generations of lovely beings out there, right? and to take care of them and to take care of yourself as well.
So mixing both messages that you were giving to us, it's really important to express yourself. And also, I love the idea you mentioned, Vicki, not to be afraid to ask to your nurses or doctors whatever you are worried about, and push to have joint conversations, because at the end of the day, it's the patient, it's your life. So you have to do what you really want to do. That's why you go to the hospital, because there are professionals who can help you and give you advice, but the choice should always be yours.
Absolutely, Anna. And I would just like to go back to Iris then. And you were saying that it was beginning to affect your mental health, that you felt you couldn't bring to fruition that decision that you'd made, that you wanted a child. Could you tell me a little bit more about how it affected you?
Yes. I saw a psychologist at the time because I was really struggling. I just felt this anxiety, and she expressed it in a really nice way. It was like I was wearing like these color-tinted glasses, and like I was doing everything that I used to be doing. I was going to work, I was meeting my friends and everything, but every experience I was having was kind of colored by this heavy cloud that was over me. And it was not like when I received the green light or so from my doctor, like, now you can start to try to conceive. That didn't happen. And I felt it was so difficult. Like, okay, now I can, but I can't. And we decided to go through IVF, because on my medication, it was for 3 months, I was told I cannot get pregnant. Like, you have to be really careful, because these 3 months you cannot get pregnant. And then you have 3 months where you can't get pregnant. And you know you only have this 3 months gap until your next medication. And this was causing a lot of anxiety in me. Like, okay, with every time I went on my periods, like, okay, that was one. Now I have 2 more. And then I have to pause. And I decided, like, I can't do this. And we also know, like, anxiety is not good for if you're trying to get pregnant. It's not helping. So we just decided, okay, we're going to seek assistance and go this route. And it was just what I had to do. Like, this is private for a lot of people. Like, they don't maybe want to tell the people around them about this. But that's what's helped me through this process. I told my family, I told my closest friends, so they could be there to support me through this. And I think that's key. Like, you have to get your support system, like, allow them to help you if you need it. And yeah, like, it was really strange. Like, I'm a planner, like, I'm a rational person, and I like to have a plan, and then nothing was going according to plan. And if I just tell you a little bit about what happened, is that I went to IVF, and the embryo was implanted, and 4 days later I started my period, and I was absolutely crushed. And here I had to decide, okay, should I go another round with IVF, or should we just pause and I get my medication? Because at this time point, it had been 9 months from the last time. And what we decided was, we're just going to pause. I'm going to go and get the medication, and we'll resume in 3 months. And I went to the hospital, and then in the evening, I'm just tired, like you sometimes feel after the medication, and I'm just relaxing at home. And some feeling comes, and I don't know what it is. And I think, is it possible that I'm pregnant? And then I think, no, it can't be, because I just had my period 2 weeks ago. So just for the sake of just for a ease of mind, I'm going to take a pregnancy test. And it was positive. And it said, like, I was already 5 weeks. And I was shocked, like, just calling my boyfriend, like, I don't know what this means, because I just had the medication this morning. So it was strange to have everything planned. Like, I had my neurologist on the MS side, I had my infertility doctors on the other, and this happened. And I was just like, how did this happen? And then came like days of panic. And then we were told that you should just relax. It's going to be fine. Don't worry about it. Which is really weird when someone has told you, like, you cannot get pregnant here. Like, you need to be careful. And then everyone was just like, oh, relax. It's fine. But after that point, everything was fine. Like, I had a really successful pregnancy. I had a healthy baby boy. He just turned 1 and he's amazing and everything is perfect. But it was, you can imagine the emotional roller coaster that this caused.
Iris, that's a fantastic story. Thank you for telling us that story. And actually, that's going to help lots and lots of people hugely. And you've made some really important points about relaxing and just, going with things. And that's when stuff will happen. Planning for the unexpected is in there as well. But that's an amazing story and brilliant.
Thank you. I also just want to add, like, with time and with like this medication, more research is always coming through. The research is always happening and we always know more. And that's great to always just keep up to date with the current research.
Absolutely. Like my lady in her 70s. It's so different now. And I'm just going to put a pitch in here for EMSP. Go to organisations who've got their fingers on the pulse in terms of what the latest information is, but trusted organisations where it's evidence-based, validated information, because it is changing all the time. Opinions change, knowledge changes, research will shift things. But I go back to my original point. You are the experts on you. You know what is best for you. And that is the voice that we all have to listen to first and foremost, and everything else will follow in that wake.
Yeah, and thanks, Iris, for sharing your whole story, because it's really impactful and inspiring for people who are listening to us that might be in a similar process or might be thinking also about pregnancy. We talk about family planning. You have talked, Iris, about pregnancy, but what comes after when you already have the baby there? So, Vicki, if I can turn to you, what are the recommendations regarding breastfeeding for people with MS, especially those receiving medication?
Depending on which meds you're on will determine whether breastfeeding is contraindicated, whether it's safe or not. Wherever possible, of course, we would recommend breastfeeding. I think your clinician will look at the benefits versus the risk in terms of breastfeeding. And there are some of the induction therapies where breastfeeding is contraindicated. But the practical things, I think, around feeding your baby is enlist as much help as possible from family and friends. I would encourage women to express as much breast milk as they can and freeze it for those days when they've got really bad fatigue or, they're not feeling so great. Things like positioning. Do a test run with a little pretend dolly before you have your baby. Find out which chair is most comfortable. Use pillows, cushions. Get other people to help feed baby if you've frozen your breast milk as well. It gives you a bit of a break. And I think, too, it's just like when you've got a new baby, and Nik and Iris will know this, that is your whole world. Don't worry about the housework. And, don't worry about other stuff like that. Just focus on yourselves and the baby. And just let everything out and get as many people as you can involved. But in terms of treatments, don't forget about your symptomatic treatments. You need to talk to your clinician about not just your disease-modifying treatments, but your symptomatic treatments as well, and whether they are contraindicated or should be stopped for the time that you're breastfeeding. But we know that breastfeeding is good for mum as well as being good for baby. So we would actively encourage breastfeeding for women with MS. And if you do have a relapse when you're breastfeeding, you can have methylprednisolone treatment and it's not contraindicated. You can still continue breastfeeding during that relapse period. Because there is a slight increased risk of relapse post-delivery. But the other thing I would mention alongside breastfeeding and practical issues is the risk of postnatal depression, both in men and women. So it's just not mums, but it's dads with MS. So there is an increased risk. And again, enlisting family and friends to help out as much as possible, and just being mindful of the exhaustion and the stress and the total upheaval of life with this lovely newborn does increase, slightly increase the risk of postnatal depression. So just be mindful of that as well. But practical things like if you suffer with spasms or spasticity or whatever, just do some dummy runs before baby is born. If necessary, enlist an occupational therapist to come to the house, have a look at stuff and see what he or she can do to help in a practical way.
Yeah, I think it's really important to talk about asking for help. Because if you ask for help, as Edith also mentioned it before, that when she was through that process, she just shared her process with her family and friends, and just sharing and talking with friends, family, your partner, it helps.
Yes.
And it makes everything easier.
Yes. But of course, some people are very much alone. They may be a long way from their families, and they may not be able to access friends who may all be working full time. Young professionals suddenly finding themselves with a newborn. It's a high-risk situation in terms of stress and anxiety. So again, I would go back to this point of reaching out to organizations who may be able to put you in touch with networks and with others. And this kind of thing, this is so helpful, just talking virtually with people. So even if you can't physically access your family and friends or a network, think about doing it virtually as well. There's nothing quite like 3 o'clock in the morning connecting with other mums and dads saying, "Oh my God, you're not the only one who's been up all night, are you?" So kind of support. The support may come in many shapes and guises.
Yes, actually, that's one of the objectives of the Young People's Network at the EMSP, that we are a network of young people living with MS and related conditions. And the idea is to connect with peers and share concerns or whatever. We speak the same language. You understand each other because we all have similar situations and symptoms. And although our lives might be really different, there's something in common really important that has an impact in our daily lives or in our lives in general. So I totally agree about the importance of having this support through patient organizations, or also like at EU level, but also at local level. So if you are a young person living with MS or related conditions and would like to join the Young People's Network at the EMSP, you are more than welcome to join our network.
Absolutely.
Just to go back to what you said, Vicki, one key point I'm hearing here, and something that we might not raise awareness enough about, you were saying about the postnatal depression and that it affects both men and women. And we always look at pregnancy and women. And it's really, really important, these messages, and see how we can raise more awareness on how it affects the men. And I'm really happy today to have Nik among us, because this is an oversight. And I think in terms of awareness raising, we can do way better in terms of mental health support to accompany both men and women in this journey. So it's a really nice point.
Absolutely, Elisabeth. I completely agree with you. And I think it's something that has been really not addressed fully and well. And I still don't think it is. And I'm so grateful to Nik for the things that he said, because this is a shared journey. Having a child, yes, mum is the one who goes through the pregnancy and the delivery of the baby, but more and more young people now see it as a joint journey from the very point of conception. But the risks come when that newborn is in the house. And the focus tends to be on mum and baby, and dad can sometimes be slightly marginalised. And particularly for men with MS, that is a risk, and we don't do it well. We don't manage it well.
Thank you for reminding us of this.
If I can just add, Vicki, it's important also that in regards to that postnatal depression or whatever we call it, right? It's important that the partners really talk to each other are sincere to each other and try to figure out the way on how to continue this journey, right? I mean, let's say I have MS or you have MS or whatever, we have that condition, and now how are we going to approach it? It's a lot on that, because I don't know, in my experience, my wife knows that sometimes I just get like hit by lightning and I just need like 15 minutes off, you know? And I just tell her that, and she's completely on that. Okay. She's like, okay, do what you have to, just lay down or whatever and come back when you're ready, you know? You gotta have those conversations, even though if they're not the fun topics that you would like to cover, but they are essential for your growth, for your family growth, for your newborn. And that's the most important, right? Because you all have to function correctly as a family.
Absolutely, Nik. That's a really important point. And I think those conversations need to be had at a time when one isn't emotionally charged, because often it ends up being sort of discussed when there's a kind of high octane situation, and it's better to have those honest conversations, as I've said, in an anticipatory way, when you can talk in a measured, calm and open way with each other, rather than waiting, until you're both stressed out and climbing the wall, so to speak. Really, really important. As much as the important between, the conversation between your clinician and yourselves is the conversation between each other.
That's a great recommendation for young people thinking about pregnancy and maternity and paternity in general. Iris, is there any other recommendation that you would like to share with us for someone who might be thinking about pregnancy at this time?
I think you're onto something here, Vicki. Like, if I think back, like when I brought up this with my partner, it was always when I was like at a, I don't want to say breaking point, but like really emotional, like weeks ago. And he, like, it's an interesting situation to be in, because everyone around you, like your family, your doctor, everyone is so concerned for your health and your well-being. And for my experience, like we need your MS to be calm, like we need you to be like physically healthy before we go this route, because of course something you need to consider, because you're going to be carrying a child.
Yes.
Yes. But those conversations, it's a really, like, it was just coming up, and like now when you said it, like, absolutely do it when you're calm. Like, otherwise it's fireworks. It's not fun. But recommendations for me, after I got pregnant, because we spent a lot of time planning. I spent a lot of time being anxious. And when I found out I was pregnant and my doctors told me, don't worry, after that point, I said, okay, that's absolutely what I'm going to do. I'm not going to worry about all the things that can go wrong. If I have a relapse, if this, if that, I'm just going to enjoy this pregnancy. I'm going to trust my body to handle this. If something comes up, I will deal with it, and I will take care of me physically and mentally, but I will not worry unless I'm giving a reason to. I think that helped me a lot. And my family and friends, they told me, like, after I announced my pregnancy and the weeks after, like, I came back, so to say. Like, they saw like this heavy cloud being lifted, and I felt like I gained my personality back, because it was such a heavy burden to bear. So yeah, I just decided to trust the process, and it worked out.
This recommendation is really good, just to worry about the situations when they happen and not in advance, because sometimes we spend a lot of time worried for something that at the end it never comes.
Yes.
And we have spent so much time worried for whatever situation that at the end it's the time that you lose. So enjoy. I mean, I'm not a mom, so I don't know it, but for what everyone says, it's a really nice process. So it's also important to enjoy the process in general.
Yeah, absolutely.
A lovely message there. I've learned a lot today, and I'm really happy to hear all those stories and those experiences, because it's also opened our eyes to what is like the prejudice we have. It can be natural because of our society and the way we're living, or the country we're living in, and so on. And hearing your stories just opens up to the opportunities that we have as an organization to better support the patients, but also work with the healthcare professionals to help with this dialogue and encourage people. I have like a lot of notes now that I can use, but there are a few quotes I love. This could be the tagline for this episode. You know you better, really, to be able to go into the journey of building a family. Another one was that the nurses can advocate on behalf of the patient, and that's a very strong one, and it's something that we really need to encourage people to do better. So they have allies there in the systems that they need to be able to work with. And something that, yes, you just asked, like, I'm not going to worry until I have a reason to. That's so, so positive. And that is, I think, a good way of approaching life in general, and not to be waiting for the worst or waiting for what's going to come next. If it could be that nothing is going to come. So to be able to have these discussions, trusted information, as Vicki was saying, to be able to build on that confidence is really important. Thank you very much on this. I'll go back to Adna. She had a little game for our guest today.
We will end with a fun rapid fire round. I will ask some questions and you have to answer as soon as possible. Just say whatever pops up in your mind. Okay? So, first question. Baby names ready or last minute decision?
Ready.
Last minute decision.
I'm too old to answer that question.
Good to
Even my grandchildren are grown up now.
I'm on your team, Nik. So, next question. Knowing the sex of the baby before or finding out at birth?
Before.
Knowing before.
Oh, I see. As an old bird, I would say at birth.
Nice.
At birth, you really?
Yes, absolutely.
To be surprised, okay.
Yes, absolutely. And if it wasn't the one I'd want, I'd say, put it back. Put that one back.
I can say that with our first child, we just knew it's going to be a girl. We just knew from the moment we started talking, or even before. And when they told us it's a girl, we almost kind of looked at each other and said, yeah, we know. It's kind of the feeling that you get. I don't know.
I had like similar, like I was so convinced that I was carrying a girl, and I convinced my boyfriend as well. We're having a girl. And then we had the sonar, like ultrasound, and they told us like, it's a boy. And we just started laughing like, what? I was so sure. Yeah.
If one day I ever get pregnant, I want to know it in advance, because as I really want a girl, like if it's not a girl, it's better to just prepare myself. Okay, so next question. Biggest myth about pregnancy and MS?
The MS stops you from being pregnant.
Exactly.
Yes.
Yeah.
Wrong. Completely wrong. It does not.
You just have to find a way. That's it. It's
yes. The myth is you can't. The myth is you cannot be a parent with MS. That's a complete myth.
Yeah. I also want to add, because Vicki, you said earlier, like the chances are higher after you deliver to have a relapse. That I've learned is also depending on the medications that you are on.
Yeah.
You may be, like in my case, my neurologist wasn't very concerned because my treatment, but he told me like, you should not have the same worries about that with this medication as maybe for another. So that's also something to discuss.
Very important. Yeah.
And know.
Very important, Iris. Yes.
This is finally the same as we talked before, that each person is different. So talk to your neurologist, talk to your nurse, and also listen to the professionals. That's why they are professionals.
Absolutely.
But important always to talk with them. And we have the last question. Which advice would you give to someone with MS who is thinking about pregnancy? Just a short advice.
Go for it.
Yeah, I like this one.
Yeah.
Go for it, plan for it, enjoy it.
Exactly.
Yeah, I couldn't word it better.
Yeah.
Just put down your MS lenses and try to see the life in the other way as well.
Yeah. Well, that wraps up this episode of Let's Talk MS. Thank you so much to the three of you for being here today and for sharing with us your experiences. It's a pity that it was a bit short and we had many things to say and discuss, but it was a really nice conversation with the three of you. So thank you for being here. I hope that this discussion has helped us and our audience to better understand what pregnancy means for a person living with MS, and also some myths related with this topic. Before we close, I would like to remind you that on the 16th and 17th of May, we are holding the EMSP Annual Conference 2025 in the beautiful city of Prague. Don't miss this opportunity if you want to connect with the MS community and engage in insightful discussions. Register yourself to the event by following the link in the description. We cannot wait to welcome you in person or online. Subscribe to our podcast channel to be informed of our next episodes. In the next one, we will be diving into the topic of mental health. You can follow us on our Instagram and Twitter accounts at EUMS Youth. Check the links in the description. Thank you for listening to our episode today. Until next time, bye!